So, welcome to Chapter 3, where we're going to start talking about treatment of psychological disorders. And this is going to give you a nice overview of the rest of the semester in regards to the treatments. And what you're going to see is a lot of these treatments are going to come up over and over again in regards to the treatment of particular disorders. So, if you're going to spend a lot of time focusing on content and becoming familiar, Chapter 3 is a good place to really focus your efforts, because we're going to see these treatments come up over and over again, and it really helps to have a basic understanding of where they're coming from. So in Chapter 2, as you recall, we were talking about the biological foundations of and causes of various abnormal behaviors. And now we're going to go into the treatment. So if you have the causes, you want to have the treatments. So we're going to go ahead and start with, let's see here, kind of an overview of the various psychotherapeutic approaches or paradigms, and then we're going to more specifically delve into the biological treatments that are available for treating mental health disorders. So first, let's just have a general overview of what psychotherapy is. And so there are a lot of treatments available for psychological disorders, and that includes both the biological treatments, which you're focusing on in this module, and psychotherapy. Now, the important thing to note, though, is that only a small percentage of those who are diagnosed as having a mental disorder actually receive treatment. So there is a real disconnect in our society. The variety of reasons we'll be talking throughout the semester on, but it boils down to that sometimes there's stigma, so that admitting that you have a mental health problem and then actually seeking out treatment may be viewed in a negative way by some individuals in society. Now, the stigma regarding mental health and getting psychological treatment for that has actually begun to lift somewhat, and there's a lot more acceptance for getting help for these issues. But there is that stigma there. There's also other issues in regards to being able to access care. Care is not cheap, and a lot of insurance can minimally cover it if you have insurance. And if you don't have insurance, the public health system, while there are certainly resources available, they are limited. And I see that on a daily basis in my private practice when I have a lot of individuals calling for services that do not have insurance and are having a difficult time finding treatment. So it's not always active avoidance. Sometimes it's the system letting people down. And of course, that's something that we as a society have to counter at some point. We can't just keep saying when people with mental health issues engage in behaviors that are disruptive to the rest of society that we need more mental health care, and then having no money to provide that mental health care. And we see that over and over again, unfortunately. Now, there are a lot of different approaches to psychotherapy, and they can be generally grouped into four major paradigms, biological being one of them. And we're going to go over in individual modules each of those major paradigms, and then some of the more specific approaches that are part of those paradigms. Now, you may hear, if you ever go do see a therapist, that those maybe favor an eclectic therapy. Eclectic is just a fancy way of saying that they're using different treatment and approaches for different disorders, because we know that certain therapies tend to be more effective for different types of problems. So, for example, if you have a phobia, you avoid certain things, a behavioral approach is very effective in treating that, whereas a behavioral approach may not be so effective in treating a disorder like schizophrenia. Okay. And so we have to really be able to choose and have all the tools. And of course, this is the tried and true analogy, isn't it? It's we got to use all the tools in our toolbox, and that certain tools are better for certain tasks. And that's a good way of visualizing therapy and why a lot of people will talk about themselves being eclectic therapists. So let's look at psychotherapy. And of course, psychotherapy is that kind of talk therapy. Not always, though. It can be more focused, like you might see in behavioral change, where they use behavioral techniques. But it is any of the psychological techniques that you will have learned in your Intro to Psychology course or other courses that you've taken here at EKU. and the use of psychological techniques so that the therapist client relationship is also in play, and the combination of the techniques and the relationship come together to provide emotional, cognitive, and behavioral change. So the reason that that definition kind of takes apart therapist client relationship is they found that alone can be very effective in some treatment options. In other words, a good relationship with somebody who engages in active listening, and that doesn't even necessarily point to or give directions, but just allows the person to be heard, can be very effective. That's why they find sometimes bartenders can be very effective in helping with mental health disorders. Not that I would go to your local bartender as first choice by any means, because there could be some other issues. But that, and then psychological techniques, because if you trust the person that you're talking to, you value their expertise, you feel like you're being heard and you trust them, then you're more likely to be open to doing some of the techniques that have been proven to be effective. Speaking of proven, that gets us into evidence-based treatment. And what that simply means is the treatment has been tested in an experimental way to try to prove that it is effective in treating whatever issues have arisen. So, for instance, cognitive behavioral therapy, as we will be looking into, has been proven to be very effective in the treatment of anxiety and depression and treating underlying cognitions. And we know that because there have been a lot of different studies that'll have people who have, say, anxiety and receive no treatment, and then those that have anxiety and then get cognitive behavioral therapy, and then they measure their improvement. And that's what we mean by evidence-based treatment. And that's what's really been pushed lately by a lot of different governments and insurance companies on these evidence-based practices. And it's something as you, as a client, you certainly want to use something that's tried and true, at least at the first line. Okay, so let's go ahead and talk about those four major paradigms. First of which is what we're going to delve into a little more detail in this module, is the biological paradigm of psychotherapy. And you can see what the assumption is: mental illness is understood as a physical illness. So remember, anytime we talk biology, we're always talking about the body and the physicality of it. And what we know is that things like medication, it promotes biological change. So the idea is if you change how the physical body is, then you're going to change the overall symptomology, and hopefully for the better. Okay, so that is the biological treatment. Psychodynamic, this is going to provide a lot of insights into your unconscious motivations and various defenses, and insights into the influence of how the past influences your present behavior. So this is going to be Sigmund Freud's major approach. And the fact that we do a lot of actions that we aren't necessarily understand. We don't know why we do them. We just end up doing them. And if we fully understand, according to the psychodynamic approach, that will free us and allow us to acknowledge these influences, and then we can take steps to counteract that influence if we choose to. Okay. Cognitive behavioral, now this is going to teach us new ways of acting and thinking, and it produces more adaptive functioning. So I was telling you, one of the things they use cognitive behavior therapy with pretty commonly is for the treatment of phobias. Okay, and so phobias are certainly something that you're going to want to have somebody with cognitive behavioral therapy, but then you also have things like with depression, anxiety can also be very effective. And the last of the four major paradigms is the humanistic approach. And what we see with that is it really increases that emotional awareness and genuine emotional expression to help help them take responsibility for their own lives. So remember, the humanistic approach was one of a kind of optimistic, that humans are naturally good and that it's the environment that somehow thwarts this natural goodness. And so the humanistic therapy is really trying to connect with people and get them back to their natural state of goodness. And if you can do that, then a lot of the symptoms, in theory, would go ahead and lift. So on this next slide here, you can kind of see the breakdown and the differences between the various approaches or major paradigms. And you can see they vary upon what their main goal is, the primary method that they use, what the therapist does. You can see some are very active in kind of guiding the person. Others are more passive, taking in your information, but really letting the individual kind of guide themselves to a particular destination. And then the length of treatment. Now, when we talk about funding, and I hate to be crass and keep talking about, money matters, but it really does in any sort of the treatment of any health condition, whether it is physical or mental. And so the emphasis, of course, is on shorter treatments. And I think as a client, of course, you'd appreciate that too. If you can get better or have more improvement in a shorter period of time, wouldn't you want to try that approach rather than something that's very long term? So, for instance, psychodynamic approach in the traditional sense, no, not the more modern one, but in the traditional sense, could take years, several times a day, for an hour a day. So you could go to your psychodynamic therapist for 3 or 4 times a week for an hour for years, uncovering some of these issues. And most people don't have the time or money for that. So you can see why it's maybe fallen out of favor. So let's go ahead and look at that very first paradigm, and that's the biological. Okay, so the biological treatment, as we were discussing earlier, really focuses on symptom alleviation. In other words, you're reducing these dysfunctional symptoms, but you're not really illuminating its root cause. So, for instance, and we'll talk about this with psychopharmacology, which is using medication to treat psychological disturbances, it is very effective and it can make a world of change for individuals. It also stops working when you stop taking the medication, and you can be back to square one or even worse than. And even more deceptively, some of the medication takes a while to start working, and it also takes a while to get out of your system. So, for things like schizophrenia, individuals can take their medication, feel like they're doing better because the medication's working, and then they go off it and continue to feel better for another couple of weeks. But then what happens is some very severe kind of fallback into the schizophrenic symptoms. So it never it treats it, but it's more like it covers it so that it's manageable, but it doesn't cure you. You're not all of a sudden better and not having these disorders that you're taking. So I think it's important to know it's a useful tool, but it is not a cure. Okay. All right. So with psychopharmacology, we use these medications, and sometimes they're referred to as psychotropic medications. And these are some sort of chemical substances that are going to affect our psychological states. So there are a variety of psychotropic medications for things like depression and anxiety, in addition to schizophrenia, bipolar, ADHD, of course, ADHD. So we need to keep that in mind, that there are a lot of them out there that are going to be able to address these psychological states. And it's interesting to know that roughly 20% of children are taking meds for psychological issues. And one may argue, that's really too much. We should not have children on medications. And I have to confront this on a weekly basis when I talk with parents, because most parents, and rightly so, are concerned about putting their children on medication. And I'm not saying everybody should be, but there are individual children that have pretty significant psychological issues that are causing them to have a miserable experience growing up, and a lot of difficulties and a lot of struggles. And I've seen where medications can make a world of difference for those individuals, where non-medicated alternatives have not really worked. And of course, I've seen ones where that hasn't really helped them a whole lot, or they've even had some side effects. So it's not a cure-all, but I wouldn't dismiss it out of hand. So that's the delicate balancing line, balance beam that we got to kind of walk when we talk about any of these treatments, is what is the cost and what is the benefit. Okay. So psychopharmacology. What are some of the conclusions that we can make based on some of these medications? Well, as I was saying earlier, it's often effective and a safe treatment. Depending on the type of medication, an awful high percentage of people that are dealing with a disorder are actually able to tamp down those symptoms and have a relatively normal level of functioning, which is great. That's what we want. Wouldn't you want, if you had severe depression, to be able to go ahead and start feeling normal again and having, your daily life? So, as we mentioned in the previous slide, psychotropic medications are not going to cure any underlying causes, because the symptom alleviation is very important, as I was mentioning in the last slide, but it isn't a cure. The drugs often have to be taken for a long time. It's not like a course of antibiotics where you take it for 2 weeks and then after that you're done. Typically, as I was saying earlier, you got to keep taking them if you want to have the positive impacts from them. And the moment you stop taking them, the symptoms are likely to return. Now, all medications have some sort of side effects. Some can be very unpleasant and even downright dangerous. So we can't just toss out and try all sorts of drugs on different adults and others who are suffering from disorders and just saying, oh, let's try this. Sometimes they even have to take a medication to address the side effects of another medication. And that's where it gets real complicated, which is why you generally, for any sort of biological treatment of mental health issues, typically will want to have a psychiatrist, especially for more complex cases, because they're going to have been trained in how to treat these disorders. And psychiatrists are the only mental health providers that are generally able to prescribe medications. Now, there are things like psychiatric nurse practitioners, and of course, regular physicians are able to prescribe medications, but they are not primarily mental health providers. They are general health providers and prescribe medications for not just mental health, but also physical health issues. So inevitably, you can't be an expert in all worlds, is what I'm saying. And there are obviously primary care physicians who are quite good at things with mental health, but that's not going to be their specialty. They haven't spent years like psychiatrists. So if you're going to get medication, usually psychiatrists are the best people to go to. However, most of that psychotropic medication is going to be prescribed by primary care physicians. They're more available. It can be very hard to get into a psychiatrist a lot. And if you have a relatively straightforward mental health disorder, say ADHD, sometimes you can get, because the medication is a pretty straightforward process, at least initially. Now, if you throw in some other disorders, what we refer to as comorbidity, then you open up a little bit more of an issue. So this next slide is just a sample of all of the various, or many of the various types of medications that are out there. And then you can see there's a chemical structure name, a generic name, and a trade name. All that can get very confusing, as you might imagine. So many of you may have heard of Prozac or Wellbutrin, and that is the trade name for antidepressants. But you may have also heard of something like fluoxetine. I know that's come across my way, or amitriptyline. I'm sorry. I butchered this. These are not easy. So that's the generic name, or you can go all the way back to the chemical symbols. So you can talk about monoamine oxidase inhibitors, selective serotonin reuptake inhibitors, or tricyclic antidepressants. And so when people discuss medications, obviously there can be some confusion based on there could be 3 different names for that same little pill that somebody might be taking. So we just have to kind of be careful about that. So what other sort of biological treatments are here? Excuse me. Felt that one coming on. Okay, so in addition to medication, something that we can do is something called electroconvulsive therapy, or ECT. Now, this was developed by Ugo Cerletti and Lucio Bini back in 1938. And what they basically discovered is if you pass electricity, putting electrodes usually at the temple, and you put it through a certain amount of electricity, it can cause a seizure in the brain. And if you think about naturally occurring seizures, that's basically all it is something in the brain malfunctions, sends out an electric burst, and it causes seizure throughout the whole brain because, of course, the brain runs on electricity, and having a surge is not particularly good for it. And so electroconvulsive therapy had a really bad reputation for a number of years. because it was not well understood. It was used in a manner that was maybe not the best. And so it was discontinued for some years, and there's still a big stigma usually attached to it. However, they have found that it can be extremely effective in treating clinical depression that is resistant to medications and talk therapy. And so, for the very severe people, this could be a game changer for those chronically depressed. And so, they usually go to about 6 to 12 sessions over the course of a few weeks. The person is given some paralytics so their body doesn't seize too badly from the electrical convulsion, and some relaxers. So they usually are even doing this under kind of anesthesia, so that they're not really awake while it's happening. And then those are administered. But after 6 to 12 sessions, they find that a lot of times that depression lifts for 6 months, a year, for a significant period of time. So it's a nice thing to have in our toolbox. It's certainly a very highly specialized tool, and one that we're not going to use too frequently. Another approach was something called psychosurgery. It's a surgical destruction of a particular part of the brain, and it depends on where they think the issue is with that brain to go in. So it literally is brain surgery. Now, this also has a really bad reputation because of one man, and that's Iga Moniz, and he developed what they called prefrontal lobotomies. And so the idea is that if people are having these major psychological issues like schizophrenia or other sorts of kind of more severe clinical issues, that if you destroy a part of the frontal lobe, that makes them more docile and the symptoms become alleviated. And so this became a very popular type of treatment, much more, as you can see here, with what they called the ice pick surgery. And you can tell that it was not exactly our modern day brain surgery by any means. I mean, they're go in there walking in their regular clothes and basically take the equivalent of an ice pick, and they take a little chisel and go right through the orbit of your eye on up into the brain. One extremely inexact, and typically once it gets up into the brain cavity, the surgeon would just swish around, basically destroying and causing mush in part of that lobe, and then reportedly seeing benefits. What they found over the long term, and this went on for 30, 40 years, so this is not a one of. This was almost 10 to 20,000 prefrontal lobotomies were done just in the United States during this time period in the early 1900s up to the 1950s. And limited benefits and frequently very severe side effects. So you could have excessive tranquility where the person's basically a zombie, just sitting there drooling, very little emotion at all. Could be totally emotionally unresponsive. And then, of course, anytime you're swishing around in the brain, you could just cause death. I mean, there are blood vessels and things up there too. So nowadays, if you do have any sort of psychosurgery, it's going to be much more precise. Of course, we have MRIs. The operating theater is going to be much more, and they can do it very exactly by not just chiseling and swishing around, but by even laser and being able to zap just little portions of the brain. If that is ever used, and this is going to be one that's rarely used, it's going to be used to treat severe affective or anxiety kind of disorders. Once again, you're probably not going to really hear about it, but it's good to know what our past history is and one of our efforts in trying to train. And I should also emphasize that during this particular time with psychosurgery, medications really weren't an option. It wasn't until the late 1950s that we began to see options that allowed individuals to have real good biological treatment for mental health disorders that didn't involve these kind of more invasive things like electroconvulsive or psychosurgery. So, all right. So that wraps up both the overview of psychotherapy and mental health approaches and the more specific delving into biological treatments. Next, in Module 2, we're going to talk in more detail about Freud's kind of psychodynamic psychotherapies and get a little more detail on that. So please stay tuned.